Good evening, everyone. Welcome to this meeting of the Health and Wellbeing Board. Like to start, item one is welcome and apologies for absence. But I'm going to add to that by introducing a thank you because there are two members of our team who have recently left. And I think it's really important that we as a board record our thanks. So firstly, I would like to thank Clarissa Larson, who has been the partnership board manager and has worked for Merton since 2013. And Clarissa has left us to work in her dream role of a mental health counsellor. And she has been studying for the last 5 years to kind of achieve that objective, and I'm sure we would all want to wish her every success in this career move for her. And secondly, I'd like to thank Dr. Dagmar Zuma, our previous Director of Public Health, who has left Merton after 7 years, and it is 7 years of dedicated work. And I think there wasn't no time where that became more apparent than during the pandemic. And you know, it's a matter of record that the council has recorded its thanks for her service then and before and after, and I'm sure we will all remember her drive and determination. So we are currently recruiting for interims to cover these two posts, and John Morgan will keep you advised of our progress. But matters are already well advanced. So, and I'm sure I speak for the whole board when I thank Clarissa and Dagmar and wish them the very best for the future. Okay, now apologies for absence. Brenda, you are here. That's good. Brenda had apologized to me, and then because she was double booked, but she likes you guys so much that she cancelled the other meeting, or somebody else cancelled it actually, but it does no harm to make you feel that you're all special in Brenda's eyes. And Si has sent his apologies, and we've also got apologies from Jane McSherry. Are there any others that have? No? Okay, no late apologies. In that case, we'll do declarations of interest. Are there any declarations of interest? No, you're doing very well. Keep going. And then item 3 is the minutes of the previous meeting. And can I ask if these are agreed as being accurate, or are there any changes that need to be made? I'll take your silence as acceptance of them, and we'll sign the that one done. And now we're going to reorder the agenda, and what I'm proposing is that we deal with item 9 first. The reason being that our colleagues from St George's need to go quickly and get on with their very important work. So you know, the paper is here, and I don't know which of you is going to introduce this item. Is it Ralph?
We'll do a double act.
Okay,
I'll kick off if that's all right.
over to you.
Thank you, and thank you very much for having us. So my name's Ralph Michelle. I'm Director of Strategy at St George's.
And I'm Sir Joe Francis. I'm a neonatal consultant at St George's, and I'm the divisional chair for the division that covers children, women's diagnostics and therapies.
So we wanted to talk to you today about paediatric cancer services, where NHS England are pursuing some changes. So I'll just do a very brief introduction and then hand over to Sijo. Paediatric cancer is obviously devastating for the families that it affects, but thankfully also quite rare. And a result of that combination is that the services that the NHS provides to treat children with cancer are extremely specialist. So there is only one centre for paediatric cancer in South London, Kent, Surrey and Sussex. And that is provided by St George's and the Royal Marsden in partnership. And it's a very good service, but it's provided across two hospitals, St George's and the Marsden in Sutton. And the issue with that is that when children at the Marsden become very sick, they have to be transferred to St George's. And there is a really strong consensus amongst clinicians that that is not the ideal setup, and that really the service ought to be on one site. And for that reason, NHS England have decided they want to move the service. So it will either in future for our region be all located at St George's, or the whole thing will move to the Evelina in central London. And that choice, which NHS England are about to, or shortly will go out to public consultation on, will have a very significant impact, obviously on children with cancer and their families, but also on St George's and the Marsden and some of our other patients. So I'm going to hand over to Sijo to tell you a bit more about those two options and some of the issues.
So St George's has been providing children's cancer services for the last 25 years or so. And as Ralph has described, we provide some of the more complex care, including surgery, neurosurgery, as well as a range of the specialties that are required to support children's oncology care, including but not limited to things like pediatric respiratory medicine, infectious diseases support, etc. And that specialty service is provided not just at St George's, but also at the Royal Marsden. So although some children may be at the Royal Marsden, the specialist input where they require the expertise of those pediatric specialists will be provided through St George's. And the provision of those services for children with cancer has been a significant component of the services that we've developed for children in a specialized way over the last 20 odd years. And crucially, in areas like pediatric surgery, intensive care, pediatric pathology, the oncology forms a very significant component of the workload that we do. And the concern for us at St George's is that if the Children's Cancer Service were to move from St George's, those services would need to also move to another site, in this case, Evelina. And that would have a detrimental impact on our ability to provide those services in the future, and would have an impact on where children from within our region, so for Merton, Wandsworth, Surrey, etc., would be able to access those complex services and the sustainability of those services long term. So that's obviously a significant concern for us. The other very important consideration is that we think that expertise that we've built up over the last 20, 25 years is quite an important factor in the quality of the care that we provide. But also crucially, the model that we're proposing is the only model where pediatric neurosurgery and oncology surgery can be provided by specialists with expertise in that at a site, namely St George's. The other options would have a reduced ability to provide some of those services because they don't have those specialists. And again, for children with cancer, that obviously has an impact. The other crucial area is our working relationship with the Marsden. The Marsden, as we said, for the reasons that Ralph has described, from the new service specifications, would not be able to host a children's principal treatment center because of the lack of pediatric specialties. But they have developed a huge amount of both clinical and research expertise in children's cancer in the time that they've been doing it. And obviously the relationship that we already have with the Marsden and the physical location of the two sites means, I think, in our view, that it provides the greatest opportunity for those relationships to be maintained, but also for all the important research that currently takes place at the Marsden to be continued to be sustained. And we've developed a very strong estates plan that we think is deliverable within the time and financial constraints that NHS England have placed on this program, that would not just have an impact positively on children with cancer, but for many of you who know what the children's estate and the broader estate at St George's looks like, this would provide us the opportunity to start improving that estate in a very substantial way to improve the care that we provide, not just to children with cancer, but to other children. I'll hand over to Ralph, who'll talk you through very briefly the next steps in this process that NHS England is undertaking.
So I think you have in your paperwork some of what went to the joint Health Oversight and Scrutiny Committee across South West London and Surrey. So NHS England have been to that committee, presented on their plans for consultation and had some feedback, which I hope you have in front of you. So the joint committee asked for more information and for various things to be done so that the consultation gives the public the full picture and enables the public to make an informed choice. I don't know whether NHS England have provided that information yet, but I'm sure they will. Their plan then is to start public consultation in September and to consult for 12 weeks for making a final decision in the winter. So that very briefly is kind of the issue, the choice that the public will be given, and a bit about the process. And happy to take any questions.
I'll ask if anyone knows whether we've received that information yet from NHS England. I'm looking at Mark or John. No? Okay. I also understand that Josh set up a subcommittee to look at this, and there are representatives from all the local authorities, and the vice chair is our chair of health scrutiny, and I think she's very well versed on these matters. So over to the board for any comments or questions. Any questions, comments? Mark.
Obviously, I am part of the NHS, and we understand that there are processes that are being followed. So my question is just around the timescales. Ralph, am I right in assuming that there's been some delay in the timescales or some pause so that further consultation could be completed?
It has been delayed, yes. So they'd hoped to consult over the summer, but I think NHS England took the view that it would be better to take a bit more time and start the consultation in September, which is a recent change.
Any other questions? Comments? Okay, well, in that case, I think we note the update. Oh, John.
Given the concerns about this move and the impact it could have on children in Merton, are we going to send a response from the Health and Wellbeing Board, from the chair of the Health and Wellbeing Board, about these proposals?
I'm a humble servant of the board, so that's why I was seeking your kind of comments or suggestions. My personal view is that I think it would be a very bad move to remove this service from St George's and the Marsden, and to I think the expertise that has been built up over the years that they've been doing it is considerable, and you've mentioned the research that the Marsden carry out. So if it is the wish of this board for the chair to write, and I know that the chair of our health scrutiny panel has expressed that view very strongly. In fact, she's the vice chair of this panel that they've set up. So but I think the more voices that are raised on this issue, the better. So is there support for that, Jennifer?
I was going to say yes, I totally agree with that, and your sentiments about the St George's and the services remaining there. We heard I'm part of on the Josh myself, and we heard a very passionate reply from a parent whose child has attended, and they felt they weren't being listened to basically by the NHS. So I think, yes, if we could have a recommendation to contact and put our thoughts forward. Yeah, thank you.
Is that agreed? Yes. Okay, good. That will be done. So we thank you for your presentation. Sorry, Karen, I didn't see your hand raised. I'm trying to multitask here, and as a man, you will understand the difficulties of that for me.
You're doing a fantastic job. I just wanted to agree with what you'd said, and also to ensure that when the consultation is launched, that we ensure that that primary care are made aware of it, because I'm sure GP colleagues would wish to contribute to the consultation. So, because obviously we value the work that's done locally, we have very well established relationships with our local secondary care colleagues, and I think it would have a big impact on primary care as well, and also being aware that certainly from a Merton perspective, that travel times and things, etc., would be quite difficult for some patients getting up to the Evelina.
Karen, that's a very important point. I believe that was one that was made at the Josh as well, and you know, it just adds to the stress and strain. And I think people in facing those circumstances are under enough stress and strain without adding to them. Sorry, yes, I'm still trying to get everyone's name.
Yeah, it's Dave Curtis from Healthwatch Merton. It was just to add that one of the concerns that's raised within South West London across the Health Watches was around the parent and stakeholder role and their involvement in the process, which obviously seems to have come out already now. In particular, that I believe that in terms of the research stream, that actually there were no stakeholders, neither parents nor charities, that would represent children that would have taken part in some of these clinical trials being involved in sharing their experience or views. So I just think for me, it's more about the confidence needs to be in the parents and stakeholders' role and involvement in that process is being taken seriously.
I think that's a very important point also. So it all points to us writing to express our views on behalf of local residents, and I'm happy to take on that task on behalf of this board. So thank you very much, gentlemen, for your presentation. We are with you, and we hope you have a successful outcome. Now, before we move back to the agenda as listed, I need to apologise because I was so concerned about making sure we got the apologies done and the thank yous that I omitted to welcome Dan Jones, who is the new Executive Director of Environment, Climate and Civic Pride. And yesterday, I was watching him with his cabinet leads, and there was him surrounded by a number of, is it 3 or 4? 4 cabinet members. So he's got to keep 4 cabinet members happy. Sorry, not me. Well, I mean, very difficult to keep me happy, as John will confirm. But you know, I think we certainly need to welcome you, and I think with all that lot, we need to wish you luck. But you know, we spent a bit of time yesterday together, and we learned that we had something in common. But we won't tell you what it is. No, actually, we have to now, because we were both presidents of student unions at university. So I don't know what that means or signifies, but an early appetite for the political environment for us both. So Okay, so item 4 is Beat the Street. Now, some of us have already heard about this today, but I wanted it to be on our agenda because I think it was a great success. It certainly got me stirred up, and I was telling people earlier on that I scored personally 3,700 points, and what really irritated me was one of my cabinet colleagues got more than me, and despite my efforts, I even dragged the bike out of the shed when I realized I was a little behind. Now, I don't want you to run away with the idea that I'm competitive or anything, but I am, and the tires had gone flat on the bike and I couldn't find my cycle helmet, so I had to rush off and buy a new one. You'll be pleased to hear, because those of you that know about head injuries will know how important it is for cyclists to wear helmets. So, but I thought it would be really helpful for Barry to give us some brief headlines, and there's a little video which will be, I think, very well received.
Thank you, Councillor. Just to reflect very briefly, when Councillor McCabe introduced Beat the Street, the smiles and the nods around the room was fantastic. And Beat the Street really captured the imagination across the borough. It got people talking about sport and physical activity, active travel, exploring communities. So that's fabulous. And the video that we're going to come to shortly will show that far better than I ever could. But we have just come back from a partnership event with 50, 60 of our partners from across Merton taking part, hearing about the good example from Beat the Street, but really about how that gives us foundations to build upon. The foundations to build on for Actively Merton, increasing the physical and social activity levels across Merton. The opportunity that the Borough of Sport provides us as well is really important about how we can make some real strides, excuse the pun, to become more active within the borough. The end of game report has been completed now, and so we'll be able to send that out to members of the Health and Wellbeing Board after the meeting. But some of the high level stats, that we had 10% of Merton population taking part in the game. That is fantastic. 20,000 people becoming more active in that 6 weeks. But perhaps even more importantly, it was the right people taking part. 38% of those people that were taking part in the game self-reported to be physically inactive. They were doing no physical activity at all before Beat the Street, which is really positive for the comms, but it also reflects the partnerships that we've put in place across the borough to build on, whether it's in the voluntary sector, within the council departments, and clearly with our NHS colleagues. So of those players that were reporting to be physically inactive, 48% of them got more active. That's a really strong gain for us. There was an increase in the proportion of adults and children meeting the Chief Medical Officer recommendations, so they were achieving the health gain from becoming more physically active. When we start to look through the equity lens, which is really important for this piece of work, the behaviour change was highest in women and girls, and it was higher in those wards in the east of the borough. So again, the game has reached the right parts of the community that we want it to do. But it's not just about physical activity. The mental health benefits of physical activity, the social benefits of physical activity are really important. And what we've seen is that there was an increase in the number of people who increased their resilience by becoming more physically active, going for a walk, active travel. Their bounce back ability increased throughout the game. And that gives us something really strong to capture within the borough. But it's not just about the data and the number. I'm not going to cherry pick lots of stats. You're going to be able to see the end report. It's really positive, and our colleagues from Intelligent Health are really pleased with what we've done in Merton, and they want to learn what we did in Beat the Street. So when they replicate it elsewhere, they can learn from the Merton approach. But it's the stories. And so we'll ask Jade to play the film now, and you might see some faces that you recognise in the film. So I'll hand over to Jade to play the film.
This is Merton.
One day I walked all the way to Wimbledon with Beat Street. This is where the magic happened.
How Beat the Street works is you have either a ticket or you have your phone, and you'll walk up to several of these little boxes that are located on the street, and you'll tap your card or phone and it'll make a special noise.
Ooh. The best thing about Beat Street, is to get points.
It keeps us fit and healthy.
Honestly, ever since this thing started, I've had no leg cramp.
We're walking in different directions, we're seeing more of the area, maybe going up that hill that we probably would have avoided before.
Anytime we've got a journey to make, we're trying to like fit in, look how many beat boxes can we get. So definitely it's taken us around Wimbledon a bit further than we'd normally go.
I wonder where I can find another beat box, and I can just go for one more and I'll make the journey a little bit longer. It's actually quite addictive.
Beat the Street fits in quite nicely with the activities that we put on because it's not age related. We can recommend it to grandparents, something that they can do with their grandchildren. It's free, it gets them out into the fresh air, it gets them exploring new areas as well. It's really taken off.
Working together as a whole team, as a whole school community, has been a really nice thing to see.
Beat the Street has been really great for us, and I know for other organisations when it comes to advertising their own activities and getting the word out there that we're here.
Lots of people in the community have been engaged, primary schools, a running team, workplace teams, the council themselves have got involved and have a team, and the NHS, parents even getting competitive.
I've just checked the leaderboard now. I've beaten my kids, which is obviously really important, although their school is beating the practice. A particular highlight was one of my colleagues knocking on my door to tell me that she'd discovered there was a slightly longer route that got her 2 extra beat boxes. For me, that's exactly what this is all about, just adding in that little bit more physical activity into our daily routine. There's something about it that's captured my imagination where I've wanted to get out and do a lot more exercise than I normally have. And then the boys being pleased if I'm doing well has made me spurred me on.
10% of the population of Merton participated. I genuinely believe that once you've got people into the habit of doing the walking for a few weeks, that will stick.
Thank you, Jade. So the game has gone really successfully well in Merton, but there's more to do. So again, the opportunity earlier was learning about and working with partnerships across the borough to understand how we build on the foundations, how we're linked to the borough sport, how we're linked to our workplaces and the health agendas. So, Chair, back to you.
Okay, the video speaks for itself, but I'll share another scenario from our household. And in 2 of my children are teachers in Merton schools, and there is my daughter-in-law is also. So there's a head teacher, my son's a head teacher, my daughter-in-law is a deputy head, and my other daughters and they're all at different schools, and they're around for Sunday lunch, and there's this discussion going on about which school was beating who, and there was this fierce competitive spirit that was coming out, and they were all making plans to go back in on Monday and get the kids even more fired up, and that's exactly what we were looking for, and it's so good. And when I was going around, sometimes I had to queue to tap the box because there were kids on their way to school, and there'd be the little one followed by the slightly bigger one followed by the older brother or sister, and it was just really nice. And I actually heard parents say that they normally drove to school and their kids had been getting them up earlier in order to walk to school so they could get more points. Now what could be better? So congratulations to all the public health team that participated in and got this off the ground and made it such a success. We really do appreciate it. Are there any comments or questions to Barry? Laura, star of stage and screen.
It's terrible. I would just wanted to add that as well as having got people more active, we've also gathered such incredible data, and seeing some of that presented this afternoon, I thought was really exciting, because I'm sure all of us spend a lot of time sitting in meetings where we look at maps of the borough and we see different bits shaded different colours, and we learn some new things, and some of it tells us things that we already knew. But actually, I thought there was a richness and a subtlety to some of the data that was gathered in Beat the Street that really I want to go away and look at in a bit more detail. Some of that stuff about resilience, about connectedness. These are subtle, difficult to pin down concepts, but we've gathered something interesting. So we must make sure that we use that to inform all sorts of things, because it's not just relevant to physical activity, be relevant to other parts of health and the services that we provide. So I think it's another exciting layer of what it's been about.
And the big question is, did you end up finishing ahead of your kids?
Of course I did.
Well done. Mark.
So firstly, apologies because I couldn't make today's workshop. And secondly, to reiterate congratulations to everyone, because I think this is also picking up on Laura's comments. It's almost like a movement or a spirit, isn't there, that sometimes is very hard to measure. And you've talked about the competitive nature. It's how do we bottle that? But it's also really important that we've started something really brilliant here. And actually it's the next steps, because we want to make sure that that physical activity and that mental health improvement is sustainable and goes on, and that we have beat the street too, whatever that might be.
Cliff Fraser.
Thank you very much, Chair. I just didn't want to be left out of this, because in fact, although I had surgery to my knee some time ago and it gives me a lot of trouble, it didn't stop me from going all over the place. One thing I didn't like is the fact that, well, one of my residents said, you know, there's a box around the corner, you can go there more than once. And I thought that was wrong. So I went all the way, like one little boy, all the way to Wimbledon, Low Morden, everywhere else. And I took my 2 grandchildren. The 6-year-old said, Grandma, this is a bit much. And I thought, you're too young to be saying that. You should be running alone. But he did do some. He doesn't live here. And so I still got him joined up. And I just wish every place was doing it. What I found for myself, I am from Longthornton Ward. I know my ward inside out, but I didn't know everywhere else, even though we share things. And so I wandered all over the place, meeting colleagues, meeting other people who saying, what are you doing? And so I'd show them, and then I give them a card or tell them how to get to it. And the last time we spoke about this in the Labour group, we said, some people said, can we have it twice a year? I'm thinking that's a little bit much, because especially the last day, if you were to ring my house now, my husband will tell you didn't see me at all, because I was out trying to make sure that I get quite a bit. But the chair wasn't very clear in coming forward, neither was Sally, so they wouldn't tell you what they had done, and you couldn't find it. And so I thought when I got to 2,000 points, that was good. But it wasn't, because they beat me, and I only found that after. But I did 2,500. I'm pleased with it. And I hope we'll do this at least annually. And regarding for schools, we talk about obesity and all sorts, and that the curriculum doesn't allow it. But you don't need more than about 10 minutes to wander around each day and do something and learn a bit more. And so that's something I think that we should look into. Thank you.
Barry.
Thank you. Just to come back, Councillor, thank you for that positive feedback. And it's always good to compete against yourself sometimes, and not just those other people's. But the repeat game is a really interesting point, and it's something that we've asked Intelligent Health. There are a number of places across the country that have done multiple games of Beat the Street. We're looking at the evidence behind it. So really important, these are evidence-based interventions. We want to establish whether it works, how it works, what we need to do differently. So we'll definitely come back with an update on what we can do. And again, recognising the schools work, the schools across Merton were fabulous. It really was. Everywhere you walked, there was children, young people, intergenerational activity, tapping in the boxes. But incredibly pleased and really proud that Perseid School won their leaderboard. It wasn't an SEN leaderboard, it was the geographical neighbourhood. Perseid School got right behind this intervention, and that was fabulous. And again, it's something that we need to showcase more as we go forward.
Anna?
just to really echo like the wonderful work that's been going on. Myself, I encourage my friends to participate in this. And I remember the very first time Julia gave me the card, I was like, oh my God, this is so exciting. And I encouraged my friend. And then when she saw the card, she was like, we've got to do this together. So then we was going around the boxes, we was, competing against each other. She did beat me. I will admit. But yeah, I just think it's really nice, and it's really nice to hear the, the statistics and even the smiles in the video. It's just really lovely to see how the community is like together, because at the end of the day, when people are together, that's where big things happen. And it's just really lovely to see. Even my friend's little brother, he was like, oh my God, this is so cool, the green card. He was getting himself into it as well. So just to really echo, it's really lovely to see the work that's been going on in our public health team, and I'm just really excited to see where this goes, to be honest. Especially if we can get the statistics even higher, of engaging the population together. But yeah, just a really comment from my end. Just well done, honestly.
Thank you. And just because she beat you this time, and that also applies to Councillor Fraser, and it certainly applies to, well, I'm going to get my bike out at the beginning next time.
No, that's unfair, because I didn't ride. I walked everywhere.
But it did say you could
I know
ride
you
or
said
walk,
that,
or
but never mind, we won't go there.
Okay, I think what I'm picking up is that members of the board feel this has been a successful event, and it is a partnership in the true sense of the word. So we should all be giving ourselves a pat on the back, and I think there is an appetite to do more. Clearly, it will need to be research based, and Mary's mentioned that, because we can't just continue and press repeat, because there could be a drop off. But I was saying on my table earlier this afternoon that we've got all those people that we've got the data from, as Laura has said, and we can identify their nearest walk and talk group, and that could then lead on to issues which address loneliness and isolation, as well as good health. And we all know the importance of that, and just getting people up and active and kind of making them feel that that's part of their routine. And there's a possibility that we capture this lot and then we add to it. So we look forward to your plans in the future to build on this very successful event. So thank you, and please do pass the thanks of the board on to your colleagues who've been involved in it. So okay, thank you. So the next item is the Health and Wellbeing Board Rolling Priorities 2023-24 Outline Action Plan, and this is also going to be a double act between Julia and Barry. So I think Julia is going to kick off. Over to you.
Thank you very much, Chair. So just to remind those who were at the last Health and Wellbeing Board, there was a discussion about what priority should be for the board for the next year. And a decision was made that the board should focus on taking a whole systems approach to tackling air pollution, tobacco and respiratory disease, and also linked to that, look at actions that support healthy workplace, particularly focusing on active travel. So I think there was a really interesting and lively discussion at the last meeting, and we were tasked to go away and come back today with some options and proposals for the board to consider. So since the last meeting, we met up with various officers and have put together some proposals that we're going to present. So I'm just going to start by giving you the kind of a bit more in-depth context, because we didn't really present that at the last meeting. I'm going to do that quite briefly, and then I'm going to hand over to Barry, who's going to focus on the kind of framework and options for consideration. So just to kick off, there is a lot of evidence about the impact of air pollution and tobacco and respiratory health, both nationally and locally. The report that you were presented with just highlights some of the recent evidence that has been presented. So firstly, the Chief Medical Officer's annual report 2022 focuses on evidence around air pollution. It acknowledges the improvements that have been made in outdoor air quality, and it also highlights sort of solutions for taking that further, but also how we focus on indoor air quality as well. So that's a really strong evidence base around the impact of air pollution on our children's development, on heart disease, stroke, cancers, that exacerbation to asthma, increase in mortality. And locally, we've also been focusing on this. So the latest Merton Annual Public Health Report that I think Dagmar presented to the board a little while ago also focuses on the health benefits, co-benefits of climate action. Specifically, it sets out about transport emissions and their direct impact on health conditions. It highlights very clearly the health inequalities. So, for example, air pollution on health isn't equal. Those living in the 20% most deprived neighbourhoods and neighbourhoods with more than 20% of the population who are non-white experienced higher concentrations of air pollution, at the same time having lower car ownership. Also highlighted the importance of active travel and the fact that over 20% of adults are physically inactive in Merton, so that's 30,000 adults. We hope that Beat the Street has chipped away at that and improved that situation, but it is a high number of residents. We also have the Merton Story, which is the Joint Strategic Needs Assessment, and that gives an overview of the health and wellbeing needs of the borough. That has highlighted that 1 in 7 residents in Merton still smoke. That's just under 23,000 residents. And we know that there are higher numbers of smoking in wards within the east of the borough compared with the rest, and among our routine and manual occupations residents working in those areas. Moving on to respiratory disease. So the 2 main areas we focused on are COPD, so chronic obstructive pulmonary disease, and asthma. So we know that for COPD, smoking is responsible for around 9 in every 10 cases, so has a very direct health impact. And also we know in terms of asthma, just under 5% of Merton residents, that's about 10,000 residents, are recorded as having asthma. So again, we know that there is higher prevalence in the east of the borough. And then finally, just wanted to mention transport and air quality. So the Mayor has set very ambitious targets for London, saying we want 80% of all our journeys to be active or sustainable. At the moment, that is 61% in Merton, but that includes 30% walking, but only 2% cycling. So we know that there are kind of great strides and a lot happening in the borough. But there's strong evidence about that impact. And then the final area is just to say that Merton routinely monitors the air quality through its air quality status report. And it does find that there are still some areas exceeding government targets. We know that between 54 and 100 people in Merton, it's estimated, die due to air pollution. So very significant health issues. There are a huge amount of, there's a lot of activity already taking place, and you know, Dan and Mark might want to come in on this point, but the report just really flags some of the highlights. So the Air Quality Action Plan in Merton will be reviewed shortly and updated, but there's also a lot of activity happening around auditing air quality in schools, around the School Streets programme, around expanding electric vehicle charging, working with Transport for London to roll out the ULEZ, and you know, a range of other activities around walking and cycling as well, including refreshing the walking and cycling strategy for the borough, developing a curbside strategy, and also you will have seen the human forest bikes around the borough. So those are all areas that are being developed. And then just to quickly mention the NHS Green Plan, that sets out, again, ambitious targets to increase active travel for staff and patients. Again, lots of activity within the NHS. Again, Mark, you might want to come in to flag some of that. Tobacco was the other area that we wanted to bring together in this package of looking at a whole systems approach. And we spent quite a lot of time at the last meeting talking in detail about how we can address tobacco control and vaping in the borough. So I won't say too much about that, but we do have a tobacco control steering group that is doing a lot of work on that. And then also in terms of respiratory disease, there is a South West London respiratory disease steering group led by the ICB and a number of activities taking place that are around respiratory disease. So that just gives you a little stock take of where we are now. What we are proposing is that we use the skills, the strengths, the drive of the Health and Wellbeing Board to take a whole systems approach about looking at those issues together. And I'm going to hand over to Barry to outline the proposal.
Thanks, Julia. And as we've heard from the Beat the Street example, the Health and Wellbeing Board works best as a partnership. And one of the priorities for the Health and Wellbeing Board, as we heard at previous meetings, was about health in all policies. So they're having that focus on health, equity and sustainability as a trio of things. So this paper and this bundle of activities really does sit well with that approach. Recognising there's lots of good work already taking place within this area. What we have set out for you in 4.3 in the paper is a framework for action with 4 key themes. So these are holistic support and pathways, individual and community prevention, healthy place and workforce, and then awareness, learning and collaboration. So what we've done in the paper, we've set out some options under those 4 themes. So to take you through just very briefly some of the potential that we have to work together. The first one around holistic support and pathways is the Love Clean Air website and the air text. This is really important thinking about holistic care. When everybody goes for their COPD or asthma reviews, having that conversation about, and you should register right now for the air text. So when the air in London is poor quality, you will get a notification straight away, helping you to manage that air quality. The second part there is about greener inhalers. So our colleagues in the NHS will know lots about this already, but there has been a recent switch to asthma inhalers that are greener. So they significantly reduce carbon emissions and they provide the same drug and dose, but they're also more cost effective. So again, thinking through that, how we can build on pilots already taking place in primary care to understand a little bit more about understanding the prescribing behaviour, but also patients' expectation and wishes. So I think that might be an important barrier, and perhaps our clinical colleagues can come in to talk that through, about how we can make a swap to the greener inhaler the norm within Merton. The second theme around individual and community prevention, as Julia's touched on, and we had a lengthy discussion at the last meeting, was about smoking. And so we are working to have outreach and engagement across the borough to raise awareness of the stop smoking services within the borough. Some of them are online, some of them are digital, some of them are face-to-face. They are all evidence-based, which is really important for us. We touched on last time, but I think it's important to flag again here about vaping. So we know the evidence is strong on vaping can help smokers quit smoking. They are around 90% less harmful than smoking, and so that switch is really important for over 18s who wish to stop smoking. But it is not harmless, and it's not for young people under 18, and clearly it is illegal to sell these devices to under 18s. So we're taking a proactive approach. We're learning, we are working, and we're just about to commission a piece of engagement and insight work to understand the perceptions of young people across Merton to vaping, to e-cigarettes, so we can understand a little bit more. So then we can develop those tailored tools for families, for schools, for settings across Merton to be able to make evidence-based decisions. And again, that work on vaping, the insights and engagement really complements the work on underage sales, clearly within the RSP over in Dan's team. Healthy place and workplace, yes, around active and sustainable planning. We've already spoken so much about active travel, that first step is the hardest. But again, thinking about the board, what can we offer? What can we bring together to get staff travel planning consistently delivered across the borough? How do our staff work across the borough? How do they travel across the borough? How do they get to work? How do they do that on a day-to-day basis? And clearly the NHS Green Plan has lots of ambitious targets for reducing car usage and promoting sustainable and active travel. We know that the council, I believe, is about to start the development of a walking and cycling plan. So thinking about the overlap between the bundle here, and again, thinking through the insights that we gathered earlier today. And we will continue to gather when we have conversations with our residents. The Mayor of London's good work standard, and the last discussion at the last board was really helpful because the board gave us, Julia and I, a real clear steer to focus on a healthy workforce too. And since that time, the Mayor has published their good work standard, and the ask from the Mayor is that every London employer works towards that scheme. So again, there's a piece of work that we need to do. If the board feel that this is an appropriate target for to work across as a partnership, we can do some analysis to understand what that would mean. Schools, air quality and asthma is really important, and there's a fabulous pilot program that's about to start working in 4 primary schools in 2 of the borough's air pollution priority areas. And again, that's got an innovative approach to monitoring air quality. So thinking about personal air quality sensors that you can use in the home and in school on the journey. And I think the important part of that is the research and the learning as we go side of things, because there's a strong academic partner within that program. Final theme is around awareness, learning and collaboration. And again, thinking about the joint work that we did to reach and engage our communities during the pandemic. Our comms and engagement team worked incredibly closely, and they still do today. And that's really important. So again, the combined reach of the organisations around this table to be able to raise awareness around the issues and the overlaps between air quality, smoking and respiratory health can be a fabulous partnership priority for us as a board. We also need to raise awareness and training on the links between the 3 and our frontline staff. Do our frontline staff understand how to signpost into stop smoking services? Do they understand about the air quality alerts that they can embed within every adult social worker intervention, for example? And the final suggestion for the board is about the community of practice. Health, whole system approach, it's iterative, it's learning as we go, it's learning from mistakes, giving ourselves the ability to make some very small learnings as we go along, and sharing that's really important for us. So developing a community of practice, sharing that across the borough and wider afield, because I think that many people will be interested in what Merton Health and Wellbeing Board are doing as we go forward. And again, thinking about potential funding bids, about learning, so we can get some facilitated sessions to learn across the board. So that's where the framework sits and the opportunities for action. So we're asked that the Health and Wellbeing Board would discuss the approach that we've set out today. Consider the options, how we work together, any further opportunities, anything that we've missed that is going to make a big difference to the bundle. And then for members of the board to identify areas where they will champion the bundle of the work. And then we will come back, if the board agrees, perhaps each meeting focusing one of the 4 themes, so we can have a focused discussion as we move through the year. So I can hand back to Councillor McCabe.
Thank you, Barry. That's very clear. And I would invite the members of the board to discuss what's been presented to us and identify their role. As we were just reminded in section 5, the next steps, there's that request that we champion certain aspects. And so over to you, John, you've raised your hand.
Thank you, Julie and Barry, for an excellent report. It was really, really well written, and I think you've covered most of the areas. I did ask the last time, and I'm asking again, because I find it quite shocking. 22% of Merton residents living in social housing smoke compared to 7.9% people living in their own home. And then you've also mentioned, of course, the huge impact that has financially and health-wise on that population. I'm interested in the pilot. Could you just give us some details about that? Just a little bit. I'm not asking for you, but just a little bit of detail about the pilot and some timelines, because if successful, how we would be able to get that across all of our other housing associations as well, all 22 or so that function within Merton.
Thank you, John. So the pilot, we have trained over the last month or so our on-street engagement team that we used so effectively during the pandemic to be qualified in level 1 stop smoking advice, having difficult conversations, so that they're able to go out to community venues, into community halls, have conversations, attend other events across the borough. For example, they were there at the carnival. So again, it's about reaching into those wards, having conversations so they can have effective brief interventions. Because as I think our primary care colleagues mentioned last time, telling someone to change their behaviour doesn't work. It needs to be an evidence-based structured conversation. So we've got the resources in place, we're training the team, and they will be out engaging across the borough, signposting into our evidence-based stop smoking services.
So just the timeline for this, because it's a pilot, when we be timeline analysing that, if it's successful, expanding?
So the pilot has started now, and it's in place until the end of March. So after the Christmas break, we'll start thinking through the data. Have we seen an increase in the numbers going through to the pilot? Have we seen an increase in number of people receiving support from the telephone lines and the self-care apps? So after the Christmas New Year period, we'll start to see some information and data.
And having forgotten to welcome you, the least I can do is give you the opportunity to ask your first question of the board.
Thank you very much. It's not really a question actually, but it's just a comment and maybe a suggestion for things that might want to be included here, or at least are recognised as happening outside of this piece of work that complement it. So first of all, I think it's an excellent piece of work, really good report, a good example of whole system working, which is fantastic. And there's clear examples of what's been happening in my area around the four portfolios that I have to support, which I won't go into and repeat here because you've already said it. But there's a couple of areas that I think are really important. One is about how we support and improve our green infrastructure in the borough. So yes, we want to try and improve air quality by reducing CO2 emissions from cars and buildings, etc. But how do we mitigate the emissions that are already there and to improve air quality? So we are planting lots more trees in the borough. I think it's 10,000 that have been planted over the last few years. We're going to be planting more. How do we improve our parks and open spaces? And there's a plan to improve and develop our open spaces and parks already, which not only help with the CO2 capture, but also provide fantastic open spaces for people to go and enjoy and get healthy and active as well, which is all part of the borough sport plan, which I've just come from now, which I think you mentioned before, and links with the thing Beat the Street, etc. So I think that's a really good thing to try to link in this plan too for green infrastructure. And the second thing, which you sort of touched upon, was about the EV charging infrastructure, that we are rolling out more EV charging points across the borough, but we're also commissioned an EV charging strategy to try to tackle the growing demand in EV cars within the borough of London, and how we keep pace with that, and how we support people to move to an EV electric vehicle over time, with the competing demand on space in the borough, and how we support people to charge outside their homes as much as possible. So thank you, Chair.
Councillor Fraser. Well, I've called you, so Mark can just wait and do that.
Wait. Okay. Barry and your team, thank you very much for this. My background, as I think you know, is health, long-standing health background. So what you've written here is quite good, but I can see a few things that I personally would like to see looked at. For example, on the border of my ward and Pollard's Hill, so Long Thornton and Pollard's Hill, is a vaping shop, which really drives me crazy because it's beside the school, Merton school next door. And a lot of the young people, they go in there first and almost in the morning, and they come out, it looks as if it's lollipops they have, but it isn't. They're in different colors. They make it very attractive, so you think you've gone to Santa or somewhere. And constantly using these. And as somebody who knows what it's like, I don't suffer from it, but I've dealt with people with chronic obstructive airways disease. I would hate to see these young generation be the next lot coming up because we haven't really done, we don't know the full impact of vaping. And I really don't like to see them next to the school because it's like a captive audience. So I don't know what we're going to do about that. Personally, I think we need to go to the schools and educate them about their whole anatomy and physiology and how things work. And we talk about the different parts of the borough, east and west, and that's a typical constant, what should I say, comparison. And for me, I'm tired of hearing it, to be honest. I actually feel that the people who we think we can't reach, we should be finding ways of educating them. Because and especially Dan talked about trees. I spend my time talking to I nearly said relatives, residents. They nearly like relatives, because especially since COVID, the trees have gone completely mad. They really decorated up with their own leaves and everything. And I know what it does, but not everybody knows. So somewhere along in our writing, we need to explain what tree gives us and what we do for them, so that it becomes as if we're cohabiting. And because some people just said, oh, just cut the trees down. So I said, when you move, how long have you been here? 6 years. Was the tree there when you came? And then they can't answer me. The tree was there before. And we can't just walk around cutting every tree down, but we need people to understand how they function and how we can work with the trees and the birds and everything else that's going on. That's not to say that they don't need a little bit of pruning, because at the moment they've gone so mad, I nearly asked the council to come and clean my new wall that I put up, which is full of stains and all sorts, but it's easily washed. And so I'm not worried too much, but we need to go a little bit further into what we're doing. And I appreciate all of this, but I think sometimes we need a bit of deep diving. Thank you.
Thank you. Mark, because Brenda nominated Mark, and then we'll come to you, Jennifer. And I mean, I suspect you might be wanting to raise the issue that you and I have been discussing. So, Mark. No, Mark, I've called you first.
Okay, so great piece of work. Really, really support the approach, and great that we've made reference to kind of the NHS Green Plan, which was signed off at the last ICB board. I think for me, one of the reflections is a couple of weeks ago we were in the middle of the hot weather. Yeah, we know that our ED departments were really kind of feeling the pressure. And part of the cohort that was there was young people who were asthmatic, and it was because of air pollution and air quality, etc. And so we are seeing some of these issues really manifest themselves in people's health, and people that are normally healthy, fit, you know, who weren't taking their inhalers with them, etc. So there is something about the communication for me. That we do that in a joined up way. And I suppose for me as well, it's just about how do we link this all up across all our sectors and organizations, because I think following the last meeting, I asked a couple of our trusts, so do you roll out the Ottawa model? Yeah, that stop smoking. And the answer was, I don't know what the Ottawa model is. And there is something about us making sure that when we do these things as a partnership, that we make sure that everyone knows what's available to them, because actually we might be missing a trick in terms of referring the right people into the right service when they make the right presentation. Does that make sense?
Mark, really important point. Jennifer.
Thank you. Yes, a very good report, and welcome the issues that you're going to be targeting, and echo Councillor Fraser's comments about vaping. As Peter said, we are very concerned about this issue, and I think we have to have some urgency in tackling this to understand the numbers involved, and also the accessibility for young people and the dangers of taking up, and also looking at the environmental impact of disposable vapes as they contain lithium. So yeah, I think we're going to have some more discussions about that. But looking at the walking and cycling strategy, again, a little bit disappointed the urgency of this. We're talking about, you know, the health effects of air pollution, and we raised back in July last year for the council to look at ways to improve cycling, walking for children to school, so they could get out of cars and get on their bikes and walk. And we're now hearing that we're going to have a cycling walking strategy, but probably not until 2024. I mean, the council has looked previously at cycling. They had a little Holland project that didn't happen in September last year. They was looking at cycle infrastructure, but we really need to move on this, and you know, delaying is costing lives. As to walking, I mean, I speak to many elderly residents who won't leave their homes in fear of tripping on pavements. Something quite simple that I really feel the council should be looking at is improving our pavements for the elderly. They stay in their own homes, they become isolated and lonely. So, you know, there are things we should be looking at now: drop curbs, tactile paving, priority for pedestrians on our roads. It's great we've got the EV infrastructure coming, but we do need to get people out of their cars. I think that's a priority, because obviously we're going to still have the consequences of PM 2.5 causing lung damage, and so this is an urgent matter, and we, you know, I think we do need to bring that forward. The 2024 is really just too late for cycling and walking. Thank you.
Thank you, Chair. Mark stole some of my thunder, but I was going to say I do feel it's very timely, because we did see it was the week before last when the weather was very hot, and it wasn't just patients with asthma, and it wasn't just in A&E. We saw it in primary care a lot as well. A lot of patients presenting for the first time with significant respiratory disease, which was a combination of the meteorological conditions and the air pollution and the pollen and everything else. But I think this is very welcome. And quite exciting in terms of the opportunities. But you mentioned the respiratory hub pilot, and what your report really clearly sets out is that these are very common conditions, COPD and asthma. So there's a huge opportunity for impact, because there are a lot of patients affected, but they're complex and they feed into lots of social complexity, as well as people's medical conditions and factors such as smoking. So it really does need that integrated approach that Mark talked about, and a sustainable end-to-end pathway for patients that's not a short-term pilot just operating in one part of the borough, but that's accessible to all patients everywhere, from diagnosis through to treatment, through to ongoing living with their condition and managing it not only really effectively, but in the most environmentally friendly and sustainable way, using the right inhalers. So I think there's a real opportunity, and you asked for how we can work together. Well, let's get together and think about how we can develop that respiratory hub pilot as something that's a really joined up offer, pulling together all these bits from health and the other work that's going on in social housing and so forth. Thanks.
Just to echo Councillor Fraser's point, I do think, her point is very important about vaping, just because obviously it is a rising concern, but also I think relating it to the whole system approach is really timely, just because, I always keep talking about this, but understanding lived experience is so important, especially for children, young people, because, at the end of the day, they will become adults in the future. And sometimes, that learned behavior, not necessarily learned behavior, but in terms of smoking or vaping, there could be a multitude of reasons why young people could access vaping. It could be learned behaviors, it could be coping mechanisms. And I feel like understanding that from a whole systems approach is a really good, way forward, in a sense, because then, we can look at negative health outcomes in the future across the population, and then target resources across the whole population. So for example, children, young people, through as they transition into like adulthood. So I do think in terms of, the public health work that we do as a team, my role is to represent children, young people's voices and to ensure that they are represented. So when I'm looking at all these, priorities, it's so important that in each of them, the voices of young people are represented and are actually heard, and that lived experience is implemented, not only in resources, but also in focus groups that, we may hold in the future. So yeah, I just really wanted to, draw in that children, young people's voice, because it is very important as they will become adults one day. And in terms of vaping or smoking, that behavior could, maintain as, they transition into adulthood. And obviously that relates to asthma. Myself, I struggle with asthma, and I know whenever I go into settings with vaping, I do struggle to breathe sometimes. So, it does, impact mental health, for example, anxiety, etc. So it's important that in work going forward, it's important to look at different avenues, how, vaping impacts mental health, or how, for example, mental health impacts behaviors. I remember someone mentioned behaviors. It's a very important, obviously, point to always focus on when talking about, work in relation to children and young people. Yeah, thank you.
Thank you. Yes.
Hi, I'm Gloria. I'm one of the GPs in Cricket Green, and I've just started a new role with public health with Barry and the rest of the team as well. I just wanted to add that the awareness point of this was really important, and working with other sectors, as other people mentioned, like GPs and other places as well. So there's a lot of things that obviously that's already done or people are aware of, but there are things that people are not aware of. So air quality, I think, is one of them. There's definitely a lack of knowledge about it. Certainly as a GP, it's not something that we routinely speak to with patients. Recently with the whole asthma sort of in a couple of weeks ago, that's kind of triggered a thing where people started thinking about it and talking about it. But actually just even having those kind of links with those sectors, schools and other places as well, where people can get that information can really help, because then they can do something about it. And same with linking with vaping as well. So as GPs, we often have a tick box that asks patients about smoking. There isn't one for vaping, for example. So if we remember, or if it comes up in conversation, that is kind of asked, but otherwise is sort of forgotten about. And again, raising that awareness for how big of a problem vaping is really important, because then people can start to ask those questions. And same with schools as well, actually. So I think someone mentioned about educating schools. I think it's Councillor Fraser, and I think again those kind of things, working with different communities, because those are the ways you can access people in Merton essentially. So I thought that was really important that people raised that as well. Thank you.
Thank you. Any more? No.
Just a really quick point from me. In relation to your point, in terms of raising awareness, I think when I was reading about greener inhalers, I think, raising awareness in terms of that is very important, just because myself, obviously, as I said, I do struggle with asthma. And I think that, I've never heard about greener inhalers myself. And I think that, raising that awareness across the community is so vital, because even myself, I would want to know what's in the ingredients, how different is it from, the normal asthma and, the inhaler I use. So yeah, that awareness is so important, not just in relation to the green inhalers, but just across all the vast areas of work that we do. But yeah.
Okay, we've had a good discussion. I'd just like to add a couple of comments of my own. I'd like to endorse Councillor Fraser's remarks about the vaping. And when you were discussing it, I was taken back to a period. I had the privilege of working with Sir Richard Doll, who was the epidemiologist who discovered the link between smoking and lung cancer. And I remember him saying that when he was a young doctor, lung cancer was so rare that if there was a case in the hospital, they'd actually drag all the young doctors in to have a look at this. This is, you know, how long ago that was. And they didn't know what was causing the rapid increase in lung cancer. And in fact, at one point, they were thinking it might have been something to do with the increased number of cars and the pollution, plus the fact that there was not smokeless, but smoking coal that was causing the sort of dense fogs in our cities. And he was the one that came out. And what struck me as you were talking was, you know, that we don't know. You're absolutely right. And, you know, who's to say that in maybe 20 or 30 years' time, we might start seeing a whole bunch of the people who are currently teenagers who are attracted to different colors and different flavors of vapes. And we find that there's some awful condition or disease that's developed as a consequence. So I think we should take that seriously. And that then brings me on to Jennifer's remarks, because like what I was thinking she was going to say was that, you know, we as politicians, some of you may have sort of spotted from time to time that we squabble a bit. But during the last few days, we've actually had some discussions about working across the aisle and trying to discuss how we could work together as the administration, certainly from my perspective, the Cabinet Member for Health and Adult Social Care, working with the opposition to kind of address this issue and see what we could do. Because whatever squabbles we may have, we both know, and we all know, that this is an important issue. I've seen the study, the research that the BBC did, where they confiscated vapes in a secondary school that were full of all sorts of really unpleasant substances that can do real harm to young lungs. So we need to do something about that. And we're actually having a meeting tomorrow. And then she went and spoiled it all by saying, well, what are you doing about cycling, or what are you doing about it? And, you know, you lot should have done this earlier, and why haven't you? And I was brought back again, because in my time in opposition, and I am one of the members of the administration that has served in opposition on a number of occasions, it's so easy to just say, why aren't you doing this? Why aren't you doing that? And you don't have to kind of spend the scarce resources and make the difficult choices and priorities. So we're not going to squabble, because we are of one mind, and we're going to work together on this really important issue. But it's very easy to be in opposition, much easier to be in opposition than to be the administration. I'm hoping you'll never find that out, but we'll see about that. But and that's me in danger of slipping into squabbling. But I think there's been some really useful pointers for our officers from this discussion. I haven't heard too many people saying, I'll be the champion of this, and I'll go back to my organization and I'll take this one on. So I'll invite you to look again at section 5 and identify the next steps. And the question I'm asking is, what have you done today to make yourself feel proud? Does anyone want to offer to become a champion of something? And Mark, good man.
I'll commit to nominating a champion tomorrow morning once I've spoken to my teams. I've certainly got someone in mind, but let me just speak to them before I nominate them in public.
Isn't it great to be able to delegate? Anyone else want to? No?
And then speak to Barry about it.
Okay. Well, that's an offer that we're intrigued by, and we'll keep an eye on. Jennifer?
Can I make a recommendation that jointly Peter and I are champions against vaping, so we actually help to improve things for young people and not to get into taking vast amounts of nicotine into their systems. So yes, and working cross-party, absolutely welcome that, and our meeting tomorrow. Thank you.
Right. Anything else? Have we given you enough of a steer, or do you want us to drill down further? I mean, there's been some very good points made here.
Just to say thank you for the contributions from everybody. I think it's been a really helpful discussion. Thank you for those who have kind of offered to champion, and we might be coming back to some people as well. And if you have any thoughts after this meeting, then do come back to us. What we've proposed in the paper is that we set up a sort of task and finish group of officers to sort of work this further. But I think if we go away and reflect on the kind of discussions today and then set up some meetings with those who have either offered or are nominating people to really kind of take it forward, and then think about a schedule of reporting back at future boards, so we can make sure that there is an ongoing kind of process of feeding back and engaging people.
Thank you very much. So item 6 is the carers strategy update, and I've got another potential double act. I see Heather going for the speaker, so it's Heather's going to kick off. Are you doing a double act, John, or is Heather right? Heather, John has delegated. There's another bit of delegation going on here, but you're very welcome to the Health and Wellbeing Board, and you know, you and I have all sorts of connections in your work, so
we do. Thanks ever so much, Chair. I do have a few slides available, but I will try to quickly whiz through them so it's not death by PowerPoint. So we're 2 years into the 5-year strategy. This is a multi-agency strategy across partners, and there's a number of people in the room today. Thanks ever so much, Chair. I do have a few slides available. This is the next time that this has happened to me. I was like, who's that interrupting me? It's me. Okay, should we go again? Okay, so anyway, I came here last year, and those of you who remember, we were making really good progress, but there were a number of challenges. And really, I think we'd been a bit overambitious with what we wanted to do. The enthusiasm of the first year, we maybe stretched our resources too thin. So actually, after the Health and Wellbeing Board discussion last June, we then regrouped and reviewed the key priorities within the strategy, and we've now set up, instead of having a number of different subgroups, we've got 4 task and finish groups, and it's very much about concentrating on some of those tasks, finishing them, and then moving on to the next task. So at the moment, we've got the Young Carers and Parent Carers Pathway, which is led by our Children's Department, the NHS Commitment to Carers Programme, led by Sarah Rushton. And I just want to say thank you to Sarah, really. She's really stepped up and has really helped progress some of the actions within the strategy. We've also got Jill Moore leading on the Carers of Adults Pathway work, and we're reviewing our local authority website. The other thing we did is we reviewed how we were engaging with carers as well. And we agreed with partners and with carers after talking with them that actually we would engage them on specific changes or specific activities rather than expect them to come to lots of meetings, because people were finding that very difficult to commit to that. However, we do want more representation on our implementation board, in particular voices of young carers too. We've just had a really successful Carers Week at the beginning of June, and all partners came together to really produce a rich array of different activities to really recognise, celebrate and value our carers in Merton. So I just want to give a very quick progress update on the young carer and parent carer pathway. So we actually commissioned Carer Support Merton to do some very specific work, looking at what needs to happen to support young carers. And Children's Department are just working out what that support looks like with key agencies. And they're also going to be looking to recommission young carers services starting April next year. So our current contract with Carer Support Merton for young carers comes to an end in March next year, and actually our adults grant agreement with carers services also comes to an end at the same time. So I'll mention that a little bit later. And we've also done some consultation with young carers, and also recently with parent carers as well. And Carer Support Merton again will be doing an independent piece of work looking at what that parent carer of young people under the age of 18 looks like. In terms of the NHS Commitment to Carers programme, we've had some real energy, as I said earlier, around this area. And it really, we're really getting the sense that there's been a real improved knowledge of what support is available to carers locally within our health services. We know this because we're seeing a real increase in referrals to some of our partner agencies, such as Carer Support Merton, Alzheimer's Society and Merton Mencap. But there are other partners who are saying this as well. St George's and Kingston Hospital are actively looking at how they support carers with that discharge process, and they're looking at how they use the new hospital discharge toolkit, which was developed earlier this year. And there's been a number of events. Quite recently there was one in Carers Week at St George's, which had some really good feedback. We're also at the moment evaluating a 6-month project that we had with Carer Support Merton and St George's. We've paused that at the moment because we need to learn. So if I'm really honest, we've had some real energy very recently from St George's, and they've got a really good plan about how they're going to support carers with that hospital discharge pathway going forward. But they weren't quite ready, I think, for our pilot that started in January. So we're just pausing and evaluating and rethinking how we get the best value in terms of that effective support for carers. But there's some really rich learning coming from that project. We know that GPs are identifying and supporting more carers as well, and that's also with the help of social prescribers and other partners. Merton Uplift, or should we say it's NHS Talking Therapies now, are working really well with Carer Support Merton. That partnership is really producing good outcomes. And also just wanted to mention the Mental Health Trust continuing to support with that triangle of care approach to support carers is again working really well. In terms of the carers adult pathway, I won't go into too much detail here, but I think it's fair to say that we want to make sure that we give timely support to carers in a proportionate and appropriate way. Not every single carer needs a big, huge, holistic carers assessment. Sometimes it's just making sure they get access to the right information and advice quickly. So we're reviewing our processes and making sure that we have more of a standardized approach across all of our partners. So that's Adult Social Care and the Mental Health Trust and our partners that complete carers assessments, just to make sure that we can really support with a growing demand and have the right type of capacity to meet that demand. And in terms of our website review, hopefully we'll be finished pretty quickly with this one, because as we speak, there's some key areas that have been updated. We worked with carers on this to really identify what else we needed to put onto our Merton Council website. We'll also be looking at other websites too with partners, but we would start with our Merton. And it wasn't bad, the information, but just needed a bit more information about particular areas. So we've increased our information around employment and training, carers entitlements, short breaks to give carers respite, health and wellbeing support locally, and more information to support young carers. We're also engaging with carers on what they think. So we've asked them what they needed, we've put it all together, and we've got an event coming up very soon, so they can be very honest with us about, is this what you needed? Is this correct? Just wanted to quickly mention as well carers cards. We've actually got the multi-agency carers implementation board that meet once every 2 months. The meeting is tomorrow morning, and we're going to be looking in quite a lot of detail at carers cards. There's lots of different types of carers cards. Some local authorities have had these for a very long time. It was a real key priority for our carers strategy. So we'll be discussing that tomorrow at the board, and then hopefully being able to kind of look at explore a bit further about what some of those options are. So watch this space, and once hopefully we get this implemented locally, we will do quite a bit of comms and marketing across the partners. So in terms of next steps, I did mention that actually Adults Social Care are also looking to recommission our carer support and services, and we'll be talking about that next week with our senior managers about the approach to that. And we'll also be talking with our children's colleagues to make sure that where it makes sense to align those different commissioning processes, we will do that. So we're talking to make sure that, if we're actually engaging with carers, carers' time is precious. So we do that together and collaboratively. And also we're looking at our CQC requirements going forward for carers too. So that's it, a bit of a whistle-stop tour in terms of what we've been up to over the last year. Thank you, Chair.
Thank you, Heather. Are there any questions or comments to Heather? Councillor Fraser.
Very much. What you've said sounds really exciting, but I am a little bit lost as to the carers cards. So I just want to know what it provides.
Yeah, apologies. I was a bit too quick on that one. So the carers card, there's really 3 strands to the carers card. It's really about recognizing yourself as a carer. And sometimes that's very important. Particularly young carers said, when I go to the hospital with my mum, I want to say I am this person's carer. You can talk to me. This is part of my role. Also, lots of carers cards have discounts. We know that sometimes people have to give up work to be a carer. So lots of people struggle financially. So we're looking at how we can have some discounts attached to that card as well, particularly maybe to access fitness or leisure activities. And also, and very importantly, some form of contingency. Not all carers require a contingency plan that is held by Adult Social Care. that, you know, actually needs to kick in if there's a crisis that their loved one can't be left alone. Sometimes it's an arrangement you have maybe with a neighbour or somebody locally to you or another family member. So we're exploring what those options are. And there's a number of different ways that carer's card can be produced. For years, it's been a physical card, but actually now with lots of, you know, developments with technology, it can be on a smartphone app, and there are different ways that, you know, if you maybe there's a number of people that provide that caring role to somebody, how they can all access that support as well, and you can keep all the information, for example, your loved one's medication and their health needs, maybe a bit of information if they do need to go into hospital, can all be put on this app. So we're exploring all those options at the moment. Transport, in what sense?
If carers sorry, want to go out with this person they're looking after, do they have to pay on the bus or on the train or whatever?
I think there's different, I don't know the detail about that. I'm happy to look into it. I don't want to give you wrong information. I think for some it's free, for others it's not quite so free. But we're actually looking at our assisted travel policy at the moment, and I think it would be useful to have something in there for informal carers as well. I don't know if anyone knows better information than I do on transport.
I'm conscious of the time, so I think we need to, I mean, one of
Just
my...
a very quick thank you very much for all the fantastic work you do. I came to meet everyone there, and they were working so hard in quite difficult circumstances. I don't know space-wise and everything, but you do a fantastic job. I'm really interested to hear about the carers card, and if you could come back and report back to us regarding that.
Absolutely happy to.
Thank you.
I'm happy to reach out across the aisle and endorse your comments about Heather's great work. Okay, so is that, I mean, we note the report and we thank you for the update, and we thank you for your very good work. So take the rest of the evening off. Okay, so the next item is right care, right person. We've got Jennifer Lewis Anthony, who's joined us online, and Graham, who's going to speak first?
Thank you. If I just do a quick introduction, and then I'll hand over to Jennifer to take you briefly through the paper. This is sorry, if I introduce myself first, I'm Graham Terry. I'm the interim AD for adult social care, and it's a paper for the Health and Wellbeing Board to note the proposals from the Met Police in relation to right care, right place, and also for the board to consider whether it wishes to make a response, which would be probably one of many to the Met Police since their original letter back in May. I'll hand over to Jennifer just to quickly take you through the paper and some of the implications arising, and then move quickly on to questions if we may. Thank you.
Okay. Let's see.
Please go ahead, Jennifer.
Thank you. Can you hear me? A quick
Yes.
introduction. Okay. Jennifer Lewis Anthony, and I am Senior Social Worker for the Mental Health Services, Associate Director of Mental Health Service. So the borough, the Mental Health Trust, other agencies, professional bodies received a letter from the Met Commissioner, Sir Mark Rowley, on the 24th of May. And he basically was advising that from the end of April, the police will introduce right care, right person. And to quickly go through that, there is a background here of the police being more and more concerned that different mental health scenarios are managed by them, or they're involved with them anyway, where they are not the agency that is skilled to do that, and also it takes resources away from policing. It's a model that's been introduced in Humberside, and that was in 2019. And the reports are that it was beneficial across services. Clearly for the police, it reduced the amount of calls and call outs that they were involved with. But it's reported that it benefited social services, health, other services involved as well. So lots of agencies, as Graham said, have responded to the police because the letter, and it's in the appendix, doesn't give much detail about what that will look like in London. But what right care, right person really means is that, well, it was introduced in 4 stages in Humberside. And so the police looked at different areas where they were involved in psychiatric crisis, along a continuum of crisis, and introduced a different way of responding so that they become less involved. It meant that health and social care staff all had to come to an agreement with the police about which agency has the right skills, the right training, the right experience, and really should be the right service to become involved. And what it simply means is that the call handlers will triage requests that have come in. They'll decide whether the police should respond or not, and where they're not sure, they'll refer to a senior. The background of this is that the police have seek legal advice, and in fact their advice is that the police duties are more specific than they've probably practiced in the past, and they have specifically cited their human rights duties. And so based on that, there is scope, they are arguing, for the police to draw back, as it were, from some of the things that we've traditionally asked them to get involved in. An example that will possibly affect social care is welfare checks, but also police involvement in Mental Health Act. In different aspects of the Mental Health Act, there is a possibility that they won't be as involved as they were. Partner agencies have expressed concern for several reasons. I must say that across the board, there is a recognition that the police are spending too long with psychiatric emergencies or crisis. And there has been work sort of to address this even before this letter. But one of the concerns is the introduction by the end of August is not feasible for any of the agencies. And also there seems to be a lack of detailed look at Humberside compared to London. I mean, the size of the population are different, the nature of the population served. There's been no analysis of how does it compare, and therefore will the model fit, you know, as just a transfer from one area to the other. And I said before that there have been initiatives. So NHS England, for example, have pointed out to the police that some initiatives that are in the pipeline or coming on stream that are going to help the police to reduce their involvement anyway. So it feels as if partners agree, but there are initiatives already in place, and also there's a lack of analysis about what this will really look like in London, and whether it is a fit for London, as you know, as practiced in Humberside. So what is really being asked for from the police is an opportunity to work together, to understand the model, to understand how it can be introduced, and yeah, and to do that to a realistic time frame. The implications really, when you think about things like welfare checks, if police stop becoming involved in that, then the implications across the board, across agencies, would be officers picking that up, where they would probably have relied on the police late evenings, weekends, etc. Might be an implication there. Some concerns around the Mental Health Act, and if the police are not involved as they are currently in the Mental Health Act, there might be some issues around risk. I mean, colleagues talk about the fact that sometimes, or many a time, in Mental Health Act assessments, having police presence there, the uniform, does support the process being not as fraught. The service user often responds to the fact that, you know, they're being guided by the assessment, but by police colleagues in the background. The AMPS report that has really helped, and if that were to stop or to change, there might be, you know, might be an issue for the AMPS carrying out the assessments. So not quite sure what these changes are going to mean, but also not quite sure what the police mean by these changes at the moment, because as I say, the letter was not as specific. In terms of since the letter has been launched and responses have gone to the police, not hearing anything official in terms of response back from the police, but there have been a lot of discussions about this. And I know that within the Mental Health Trust, there's going to be further discussion with the AMP services across the local boroughs to start thinking about where the gaps will be and what that will look like. It's likely that, it's been said that it's likely that it will be a more slow introduction. But as I say, because the police haven't actually responded to the response letters that they've received, it's still unclear. And on the ground, there were reports that police are already changing their practice. And it's been concerning for some colleagues involved when they're asking for police assistance, which obviously has been flagged up. But that's the main points.
Thank you.
Yeah, that's the main points.
Thank you. I am conscious of the time, but as you've been speaking, I've been looking around the room and see a lot of nodding, and I take that there is quite a degree of consensus on this. I participated in a discussion with the chairs of the London Health and Wellbeing boards, and there was very strong opposition to the imposition of this with the timetable. And you've also referred to the pilot having taken place in Humberside, which has a population about 1/10 of that of London, without the diversity and the kind of the comings and goings in a huge city such as ours. And so can I kind of move us along and ask whether we can note the report? And I think the question is, do we want to write to the Commissioner as a board to say that we think these proposals are as set out and with the timetable set out are very difficult for partners to achieve? And you know, the essence of partnership working is that you discuss rather than impose. So is there support for that proposal? Again, I see lots of nodding. Is that agreed? Okay, thank you, Jennifer. Graham, do you have anything to add?
No, nothing further to add to what's already been said. Thank you.
Thank you very much. So we're now, and I will, on your behalf, write to the Commissioner of Metropolitan Police and make sure that I stick within the speed limit for the next week or two. Sorry, Dave.
Just going to add as well, it makes the assumption around the new health, mental health Concordat, but actually I don't think Merton has signed up to that as yet, and nor have loads of other local authorities. So they're not just a step ahead in making assumptions, but also a step ahead of the fact that people aren't signed up to that yet as well. That's not a criticism. It's about the fact that they're moving at a speed that's just not right.
Star Trek, really. So Mark Rowley, you know, he wants to move to, what do they call it? Mark Warp 2 or 3. Mark, sorry, we're talking about one Mark, and then I'm inviting another Mark to confusing
Mark
things.
1, hopefully. My understanding is that the Concordat is being developed, and I think since the initial letter, I think there have been lots of conversations about timeframes and about partnership working, with the emphasis being we all want the best for people with mental health issues. But actually, I think there is work now developing that kind of partnership agreement going forward at a London level.
Brian might be able to help us with some information on that very point.
Thank you, Chair. For colleagues who don't know me, I'm Priya Samuel, Integrated Partnerships Manager for South West London St George's Mental Health Trust. I would like to share just some of the work that the Trust is doing in relation to Sir Mark Rowley's letter. The Trust has published its response to the letter, which is available on the Trust's website, and I can share the link with the Health and Wellbeing Board should you wish to have it. In addition, through Jennifer Allen, our Chief Operating Officer, we will be organising a South West London 5-borough basis meeting with Met Police colleagues, and that meeting will be taking place circa end of July. And in the spirit of partnership, as Mark Krillman mentioned, we would welcome if the Health and Wellbeing Board would like to take up this offer of including a colleague from the local authority, you know, or AMP representation to take part in the pre-meeting so that the local authority voice is heard through that forum. Thank you.
We'd welcome that, and I'm sure John can nominate somebody to perform that role. So can I come back to the? I mean, take your point, Dave. We'll check exactly what the status is, and we'll make sure that the wording is kind of consistent with where we are at the moment, and not assume anything. And again, I'll look to John to help with that. But are we? Sorry. Oh, Jennifer, I can't. Oh, yes, I can see your hand. It's right up in the top.
Sorry, I was going to say that I'm already invited to that meeting.
Okay.
The Mental Health Trust meeting with the police.
Well, it appears that that's one less task for you to perform, John, and I'm sure you'll welcome that. Well, what that demonstrates is that great minds think alike. Okay, thank you, Jennifer. I'm going to draw this one to a close because we've got a number of items still to get through. And I ask those of you that are introducing those items to, like crocodile sandwiches, make it snappy. Let's move on to the Better Care Fund now. No, sorry, it's the IPC strategy. So that's Mark.
So I'll try to be quick. There's two documents basically. There's the ICP strategy, which has been circulated, and just for the board to note that there was a workshop about 4 weeks ago now that just brought 300 stakeholders across the system to come together to turn that strategy into some action plans. And it's just to remind people that the 5 areas of priority are preventing ill health, promoting self-care, positive focus on mental health and well-being, supporting the health and care needs of children and young people, and some of our young people were in attendance at the workshop, thankfully, tackling and reducing health inequalities, which I believe our chair got on the priority list, and then community-based support for older and frail people. So that really is now about turning those strategic priorities into an action plan. So I just wanted to note that piece of work is ongoing. The joint forward plan, and apologies for this, the timing of this is just really, really awful, is that the ICB board, as we were setting the papers for this meeting, they were ahead of the ICB board that is receiving the joint forward plan. So we couldn't send the plan out without it being signed off, but it is on the website now under the agenda items, and tomorrow we will send it round to everyone. Just to say, it focuses on many of the same priorities that I've just discussed, but it is also about keeping people out of the hospital, using technology more effectively, managing our finances effectively, making South West London a great place to work. And the joint forward plan is the NHS plan. This is a 5-year plan and will be renewed annually. What we are asking the board is we sent Councillor McCabe a copy of it prior to the meeting and prior to it going public. We wanted to ask the board to delegate a comment from Councillor McCabe that can be included in the strategy going forward, or the joint forward plan, and then we would bring the paper to this meeting in September for further consideration.
Thank you, Mark. And those of you that know me well and my views on such matters will not be surprised to hear that I argued the case for health inequalities to be included in that strategy for South West London, and you know, I felt that there was sufficient support in the room for us to get that included, and I'm delighted with it because that is a real priority for Merton, in case you haven't heard that ever. So thank you, Mark, and I'll get the comments through to you very, very quickly. So that's that item done. We've done item 9 as one of the first items. So item 10 is now the Better Care Fund, and is it Phil or Annette going to?
So I think we're going to do a double act like most people here, but not very long. I appreciate we have to be snappy. Yeah. So those who don't know me, welcome. My name's Annette Bunker. I'm Assistant Head of Transformation for Integrated Care at the ICB. And you should have in your papers an overall summary of the Better Care Fund plan. Normally we present an annual plan to you, but this year we've been asked to submit a 2-year plan. And that really gives us further opportunity over the next 2 years to bring services closer together and work out how we can integrate services more. The role of this group really is to review this and then support the overall submission. And to help with that, we've provided some brief slides, which I hope you've had a chance to look at. But in brief, it gives you a summary of what the Better Care Fund is, about how we can work together in a single pool budget. And the focus is really about having joint services and ring-fence budgets where we can focus on specific funding for certain areas. The presentation also gives you a summary of the funding that's available. And since last year, that also includes the Adult Social Care Discharge Fund, as well as the previously included areas, which have now been increased, and they're increased year on year. What should be noted, I think, is although we've been asked to do a 2-year plan, actually the money for 24-25 is still a proxy, and actually that money the budget still needs to be finalised for those. So we're working on estimates at the moment, and we'll obviously report to you again when that's clearer. In fact, we'll have to do an annual refresh of this. So there's the national objectives and conditions, which the objectives are the same as previous years, and the national conditions have been updated slightly, but the essence of it is a joint plan, how we work together better, and how we make sure that in terms of the NHS funding, that supports adult social care. As part of the submission, which we've summarised in the presentation, there are also metrics attached to measure our success. And we had a discussion at the Merton Health and Care Together Committee about bringing those metrics back to that group to make it a bit more not just about the metrics, actually about the actions behind how we're going to achieve those. So most of them are really about basically trying to provide more care to people in their own home. So some of it's about preventing admissions, some of it's about trying to return people to their usual place of residence. And then shall I hand over to you? Yeah, briefly. Yeah, okay.
Thank you.
Yes, so I'll, again, just been very brief to follow on. You'll see in the slide deck, the slides that follow on around the local plan and the priorities. Broadly speaking, there are around 3 areas. The BCF is long-standing. It's been around for around 15 years now. So you'll see that some of the schemes, some of the services in there are quite structural to what we do. Broadly 3 areas. So there's working as part of multidisciplinary teams within localities that are framed around primary care networks. A lot of the emphasis in there incrementally over the last couple of years has been around admission avoidance. There's the underlying theme around keeping well within communities, but all of the ongoing work with different approaches to supporting people outside the acute setting. There's a whole host of schemes that fit in the gambit of intermediate care, so supporting people out of hospital and into the right place and the right care and support ongoing. And then there's the underlying theme around health inequalities. I think the final bit to touch on around the timing is that it's always a very quick piece of work when planning guidance comes to BCF. People who've been involved for a long time have asked for multi-year settlements, and this is the first time we've got that. So we've got the opportunity to look across those 3 themes and get into a bit of detail around not just moving pieces around, but understanding the impact of all the schemes that have been brought into the BCF, whether they're working effectively together, and whether improvements can be made to how they work together to inform and improve those metrics going forward. So we've done the planning piece of work in the quick time that we've got to do it, but we've got longer now to review and refine what we do.
Can we note the report? That agreed? Thank you. And then item 11, and I'm sorry that we've had to cut you short, but you appreciate the difficulties of actually cutting so many other things that we had to discuss tonight short earlier. So item 11 is a very straightforward one because we've heard from Anna a couple of times tonight, representing the voice of young people and doing it extremely well. And the proposal is that we should extend her time with us. And I suspect that the answer will be a resounding yes, but surprise me if you like. Good, thank you, Mark. So is that agreed, the proposal that as put? Great, thank you. And thank you for your contribution thus far and what you will continue to do. Great. Okay, so my apologies, because it's now 2 minutes beyond the time that this meeting was scheduled for. And I pride myself on getting through the business quickly, but I have failed tonight. So mea culpa, as they say. But I will try and do better next time. Thank you for your contribution, your comments and your questions, and your interesting, the interesting discussion that we've had this evening. Take the rest of the night off.